Let's move a little bit beyond the screening topic now and talk about some of the various treatment options for patients that have been diagnosed for prostate cancer. Currently, options for therapy include radical prostatectomy, whether that be open versus robotically assisted, radiation therapy, which could be IMRT/external beam versus brachytherapy or seeds, cryotherapy, freezing of the prostate, HIFU, high-intensity focused ultrasound, which is not a currently FDA-approved therapeutic, targeted focal therapy, and active surveillance. So those are all the things on the table. Mark, you're in a group that basically has integrated services. You have the ability to offer all these therapies, for the most part, within your urology practice. I think the beauty of large groups is that, especially for those that are fortunate to have their own radiation services, it's integrated very much like Dr. Crawford had alluded to. You have the ability to hopefully evaluate the patient, look at whatever parameters, offer various modalities. You're not kind of stuck in this mindset where, as we say, if you own a hammer, everything looks like a nail. So tell us a little bit about how you guys view robotic surgery, what you're doing, talk about experience within your group, volumes, those types of things.
Well, we started doing robotic prostatectomies early. And when we first started doing it in our larger group, there were just 2 or 3 of us that were doing it. And so those patients who needed it would be referred to us, and it has been growing since. Today, we cover, I think, 7 major hospitals and several satellites. And each hospital has the expectation that they want to offer this to their patients. And so now nearly all the hospitals have bought their own robot. And the urologists in my group that go there have someone, 1 or 2 or more, trained to do the robotic procedures in each of those hospitals. I'm not sure that that's the best model. I think the volumes are pretty good with this, but they're probably not the volumes that you will hear about some other models where you have 2 or 3 designated robotic prostatectomists and they're all referred to them. But I think the expectation today, and this is what we're seeing with our new recruits, is that they want to take prostates out and they want to use the robot. And most of the academic institutions, and Dave can speak to this, but most of the academic institutions, I think, are emphasizing the robotic prostatectomy, and most of the residents today in their training are doing it that way. There's not too many of them, I think, that are being trained primarily to do retropubic prostatectomies anymore. So those of us that are doing those are probably going to fade away at some point, and they'll all be done with the robot. But the other thing I would say is that I think it's a fantastic tool, and it's going to get better. We're just seeing the first, second, or third generations of it. What's it going to be like in the next 10 or 15 years? I mean, I've heard some of the projections, and I think there's going to be a lot of innovation, a lot of improvements on it, and it's going to be an amazing instrument. But it still is a tool, and it's just a tool. And there are still people out there who don't do a good job with it, and other people who do a fantastic job with it. So that's my long answer.
David, so at the academic institutions, I know a number of institutions actually fell behind very early on in terms of the adoption of robot, and they're scrambling to catch up now. What's been your experience out in Denver?
Well, I think that's our case. I remember Intuitive came to me a number of years ago when the robot first came out and said, you know, if you don't get on this bandwagon, you're going to be way behind, which were kind of fighting words for me in a way, whether good or bad. We have continued to fight it, but we do have a robot now. I think we're probably the last in town to get one. Nevertheless, we have a couple of our faculty members that are doing it, and they're picking up. I think as you said, it's a tool. I have some issues with some of the misrepresentation that's out there that you're going to be a better man than you were when you started if you get a robotic prostatectomy. You look at websites and you see that. As you know, I gave a very blistering talk at the South Central section a couple of years ago about a lot of the hype of the robot. And I think it's a little concerning, as you said, that the residents aren't trained in open surgery anymore, because some of these will have to be converted. I continue to do them, and a number of our residents are going out everybody, as you said, a lot of urologists aren't in large groups, and they're in small towns and that don't have robots. I think the other dangerous thing with this is the American way is sort of missing in the way of competition. What's out there competing with it? Other companies that have come around have kind of been squelched, and so we need competition. And I think when we see that, we'll see a lot of improvement.